Good afternoon. My name is Alina Ruiz. I'm an RN BSN, certified med-surg nurse, and I'm going to present to you today a comprehensive strategic and marketing plan for Parkland Hospital. This presentation is part of a course curriculum for the nursing administration graduate program for University of Texas at Arlington. A little bit about Parkland, just a short timeline. In 1894, Parkland opened its first original doors. They have moved twice since then. And the first time was in 1952, was when the original new Parkland building opened its doors. In 1962, Parkland was the first to model a nurse-driven triage model in the emergency room. In 1971, Parkland opened their first pediatric burn unit. In 1979, Parkland's diabetic patients became first in North Texas to use insulin infusion pumps. In 1985, Parkland played a leading role in passing legislation to ban patient dumping of unstable patient, which is when facility can refuse care to the patient and transfer them to another facility, even though a patient is in critical condition, but they are unable to pay. In 1994, Parkland won an award for excellence in community service. In 2015, the newest Parkland Hospital opened its doors, and it's a facility that is 2.1 million square feet big. And at the left bottom corner, you can see a real picture, a computerized picture of the actual real model. In 2016, Parkland received an award, a Gage Award by America's Essential Hospitals for reducing time and cost burdens on the patient. In 2018, Parkland received its Pathway to Excellence designation. And currently, Parkland is applying for the Magnet Status program, and it will be very unique if they do achieve it, because there are very few national hospitals that have the Magnet status and are also safety net providers, such as Parkland. Important statistics about the new Parkland. It houses 862 inpatient beds. It has 108 outpatient centers throughout the DFW Metroplex. It sees over 1 million patients per year that is combined between in and outpatient visits. Its emergency room sees over 258,000 patients visits. Parkland delivers 1,242 newborn deliveries annually. Its total revenue between the inpatient facility and all the outpatient facilities is almost $7.5 billion, as you can see. It employs 10,000 employees, and it is supported financially by local taxes, donations, and government programs such as Medicare and Medicaid. Now, next, we're going to talk about the external environment. I wanted to build a more clear picture about where Parkland stands and why the community needs this facility to thrive. Now, Parkland is located in the medical district in downtown Dallas, along with 3 other major hospitals: UT Southwest Medical Center, Baylor Medical Center, and Children's Medical Center. Now, it is important to mention that UT Southwest and Baylor Medical Center are both private facilities. They're not publicly funded, they're not publicly owned. The only other public facility in this area is Children's Medical Center, which services, of course, children. Medical District is spread over 1,000 acres and employs about 35,000 people. Medical District between these four facilities sees over 3 million patients annually. Now, a little bit about the Dallas County unfortunate statistics. Now, Dallas County is the second most populous county in Texas. It is the 9th most populous county in the nation. So it has over 2.5 million residents. Unfortunately, 24.75% of these residents are statistically uninsured. There are about 273,600 diagnosed diabetics in the Dallas County, and 18% of the county residents live on an income that is considered nationwide below poverty. A little bit more about how Parkland does what it does. Its patient care delivery model is based on team or modular care delivery model, which is where a team of interdisciplinary professionals coordinate efforts to meet patients' unique needs. Now at Parkland, professionals such as physical therapists, occupational therapists, speech therapists, wound care specialists, radiologists, nutritionists, internists, meaning internal medical providers, surgeons, specialty providers such as kidney providers, cardiologists, hepatic teams, and such, case management, social workers, financial counselors are all working together to be diligent in providing the care that our patients need and meeting patients' needs. Patients at Parkland are seen as a whole human versus a set of issues. So they're treated for their medical issues, but the medical providers, when the medications are prescribed to them, the pharmacist ensure that the proper teaching has been done, that this medication will be available, affordable to the patient, and that the patient is aware of their resources and how to ensure they continue taking the medication and that they can afford it. Our social work and case management works to find living resources for many homeless patients of Parkland. Additionally, our Parkland financial counselors help finding resources and such as Parkland Insurance Plan or government programs such as Medicaid and Medicare, and aids with applying for these programs, so that the patient can have the resources, can utilize the resources that are available and a lot of times unused, to get their medications or their medical supplies, or their transportation or their living expenses, etc. and etc. Nurse to patient ratio at Parkland is determined through a series of criteria. These include specific patient needs, necessary skills to care for these patients, patient acuity, workload data, competency of staff, and recommendation of the Nurse Practice Act. All of these are considered to create appropriate nurse to patient ratios within the Parkland facility. Now, this is our strategic plan for the years 2020 through 2023. There are 5 set goals by this facility. The first one is to build a culture of trust and staff community engagement, meaning we want to get out there and get to know what people need, where there are areas of biggest disparities, and we want to include ourselves into those areas. We want our employees to be engaged there. Second goal is to invest in the future of healthcare by teaching and learning through research. And Parkland is known for being one of the biggest medical research facilities as well as the teaching facilities. We teach doctors, we teach nurses, radiologists, we have nursing students, and such and such. The next goal is to improve value from the perspective of the patient. Parkland strives to understand what the patients are lacking and to educate them, to have them know what their resources are and what resources they need and how to find them. And the next goal is to deliver patient-focused care and create large capacity clinical model. So we want all these details to work within the community to prevent patients to coming in with exacerbation of chronic conditions and complications of undiagnosed conditions due to not having seen a doctor or not having resources to get their medication. And we want to do this on a large capacity because Dallas is a large county and we need to accommodate that population. And finally, our last goal is to deliver health services in a way that reduces health and well-being disparities in the Dallas County. It is important to understand that a county is only as healthy as its sickest members. So we cannot, Parkland does not want to forget anyone that needs help. We want to know where the disparities are, who is not getting the health care that they need, and why. And we want to plug ourselves in there and fix that. Now, during the first year of this strategic plan, we will focus on several things that work towards each of our goals. First, the pilot projects will be we will pilot projects that will be focused on innovative approaches for chronic disease management. For example, heart failure exacerbation education is very important. Diabetic management education is very important. Knowing what to eat and knowing how to see signs of needing to see a doctor, for example. Education and awareness of cultural competency. What this means is that it is important, and Parkland strives to provide widespread written education in several languages to meet the needs of our community. And at the same time, we aim to provide cultural competency to all of our facilities, our employees, and those people involved in the care of the community, so that our diabetic patients who are Hispanic and are struggling to stay within the diabetic diet can understand what they can buy, so that the local grocery stores advocates and has education within the stores as to which items would be compliant with a heart failure diabetic, low sodium, low fat, low cholesterol diets and such. Now, next one is exposure of nursing students, medical students, and nursing students to information on the population safety. And all this means is that everybody that comes through Parkland facilities, whether it's nursing student or medical student or any other kind of student personnel, we aim to educate them on the disparities in the community and on cultural competency, as above mentioned, so that then these nursing students or medical students can feel empowered to pass that along. The more people are out there spreading the word, the more powerful the word becomes. Now, next is resources and coordination of care. We strive to direct our resources in the areas where they're needed the most. And care coordination is only one of the ways to do that. Now, for example, if we know that within a certain community we have a lot of elderly people, a lot of people that live below the poverty line. We want to direct resources their way. We want them to come in and get the checkups, get the diagnosis. We want to provide them with educational resources. We want to coordinate their care so that they know how often to see a doctor and when to get their prescriptions and how to care for themselves at home. And finally, within the first year, Parkland plans on establishing communication between Parkland leaders and the community. Now, this meaning Parkland leaders in research and marketing would go out and speak with the people in the community and ask them, do they go to the doctor? Do they go to the emergency room? Do these people have conditions that are unmanaged because they're unable to afford it, or they don't have resources, or are they undocumented and such? Now, during year 2, 1 second. In the second year, Parkland plans to adopt a steady rate of innovations, meaning that our clinics will have established the processes that they need in order to get the new patients in, find these patients, and we will adopt a steady rate of innovations of how to prevent emergency visits, unnecessary emergency visits. Now, Parkland will also implement performance management process. This is important to evaluate whether or not our goals are being accomplished. And this will be done through data collection, data analysis on a regular basis, and by a multidisciplinary team of leaders. Now, next, Parkland will prioritize research projects. This meaning that those projects will be prioritized which are established to be the most necessary for the community members who are being forgotten. Okay, so if if Parkland finds within the first year that there is an extra 10,000 undiagnosed, unmanaged diabetics, then our research resources will go towards projects within the diabetic research, within how to address the management with diabetic diet in the community, and etc. and etc. Parkland will utilize metrics through the IT platform, and so it will pair up with IT specialists and will log all of this data from research, from communities and having community events, and track this data to have it analyzed by experts and to further understand the disparities within community. Parkland finally, within the second year, will engage private sector and community stakeholders in this project, in this overall project to increase the well-being of the community. Private sector are large business owners who have interest in improving the community wealth and health and well-being, and have the means to support Parkland in doing so. And community stakeholders are politicians, celebrity personnel, and yeah. So this is the second year of Parkland strategic plan management. Now, in the final year, the third year of the strategic plan implementation, Parkland will finalize funding the programs that align with the population needs. So now we have done the research, we have realized which programs and projects need to be streamlined out there for the public, and we have find the funds to do so. Parkland will further address employee engagement gaps. Now, we want employees to be engaged in the community. We want them to be out there in the events that are hosted by Parkland, in the health fairs, in the clinics, volunteering, and using their creativity and their various talents to be on the front line educating the community members. Additionally, Parkland will pursue collaborative projects based on research. And this is just further solidifies that the projects that have been viewed through a variety of interdisciplinary professionals such as pharmacists, nutritionists, medical providers, research doctors, nurses, specialists, will receive the attention and the focus that they need to, again, be streamlined into the community. Parkland will develop IPUs to address gaps in care. Now, these are actually I am so sorry. So these are actually units that address specific gaps in care. So if we see that in this zip code, there is no outpatient clinic. Additionally, in this zip code, we have elderly members of the community who are likely uninsured, who are likely living in poverty. We will address that by placing an outpatient clinic there, by hosting an event for this community members. And finally, Parkland will launch shared systematic community network. And this is a larger project, but hopefully it will be able to launch within the 3 years of the strategic plan. And this is the management of data between Parkland and political leaders, as well as health leaders, as well as national health leaders, such as Center for Disease Control and Diabetic National Association, to bring in all of the resources that are out there for these community members who aren't able to find the resources themselves. Sometimes are even unaware they need those resources. It is important to discuss the payer mix. So, and this is basically how most of the medical expenses are covered in Parkland. As you can see, there only 8% of Parkland medical expenses are covered by commercial insurances. And these are insurances that we pay for as you know, through employer, or sometimes people buy private insurance and can pay for it. So only 8% of medical bills at Parkland are covered by these commercial insurances. And you can see that over a half are Medicaid, Medicare, and charity. So this is important to note because this is different from other hospitals where commercial insurances and private pay are the majority of bill coverage. Parkland depends on the government programs and donations. Now, the marketing plan to achieve this strategic 3-year plan consists of decreasing emergency room visitation rates, increasing clinic visits. This actually says decrease, but increase clinic visits, and bring in additional revenue, and it will result in additional revenue. Our target groups are stakeholders and the community members. Additionally, we will need a dedicated marketing team and our employee engagement. Now, our target groups. The stakeholders, as we discussed earlier, are celebrity and social media influencers, and social media has become a major marketing tool, and this will help spread the word out to the younger population. And maybe these are the grandchildren of the people who need attention. But it targets a whole different possible group of community members that may need these services. Political leaders. These are people who are involved in the whole well-being of the community. And small and large business owners. Now, small and large business owners can utilize this as an opportunity to thrive their businesses in the areas that would assist Parkland goals. They can also just be a location where written education is distributed, and just written services. They can find out about the services that Parkland provides. And our other target group is, of course, our community members. So the impoverished population, the patients with unmanaged chronic conditions, the frequent ED visitors with the chronic and conditions and exacerbations, and the uninsured. Now, the marketing team will consist of 7 to 10 marketing specialists, 3 of them being leaders in the field, 3 of them being additional employees. They will create written informational booklets, and these will vary from facts about diabetes to how to find a primary provider, to what are your resources and what websites or what phone numbers to dial to find out if you do qualify for Medicaid or Medicare, or what other resources you may have, or Meals on Wheels. Further, this marketing team will actively recruit employees to contribute time and talent to the program. As Parkland employs over 10,000 people, many of these people have talents other than what they do for work, such as creativity, singing, dancing, speaking, and just reaching out to the community. And Parkland strives to encourage this by creating incentives for the employees, by creating a recognition program for the employees who are involved in the community services. This marketing team will be dedicated to organizing community events. Now, these community events will concentrate on one specific issue and will be placed in target areas where those community members that need it most can see it, hear it, and walk over to it. And finally, this marketing team will network with involved stakeholders and the potential influencers. So they will collaborate, whether these persons can attend a community event, whether these people can sponsor another a blood pressure check event, an educational event for the Parkland community members. Now the marketing timeline is quite simple. And by the end of 2021, only one event will be organized, because majority of this year will go to getting together the marketing team, organizing and planning, and kind of putting the backbone into the project. By the end of 2021, the plan is to have one event each per month, with a different target specific audience, such as diabetics, chronic heart failure, kidney failure, cancer patients, etc., in different areas of the community. And by the end of 2023, there will be a dedicated schedule, complete with events for the community, complete with written material, and employees who are committed to participating and helping in the planning of these events, along with the stakeholders and the celebrities in the community. We are hoping that by doing all of this, we achieve these things. We achieve 200,000 additional outpatient visits annually. At the same time, we will decrease our emergency room visitations by 25%, specifically those related to chronic condition exacerbations and unmanaged diseases. We hope that 100,000 newly educated community members will be out there who will know their resources, who will know how to find a doctor, who will know their health status. And all of this will bring about 100 to 200 in the first 100 to 200,000 additional revenue in the first year, and about 5 to 7.5% additional revenue from new patients and preventative interventions annually from the strategic plan. Now, this is just a visualization of everything that we spoke about. This is expected increase of outpatient visitations. Now, you can see that year one, this is our red year. There's only about 8,000 new visitations. By the end of year two, we will be at 20,000 new visitations. And by the end of year three, we hope to be at 200 new visitations. And as you can see, this increases exponentially in year three, just because the majority of our programs will be up and functioning by then. And we do expect results pretty quickly because of the needs in the community. We additionally, at the same time, expected to see decrease in emergency room visitations. Now, these are specifically related to patients with chronic conditions and unmanaged, undiagnosed conditions. And as I stated earlier, we expect by the end of 3 years a decrease by about 25%. So our average in Parkland, about 1 million visitations, emergency room visitations per year. And so we are hoping that as a result of the strategic plan, we will end up with around 750,000 visitations per year, and that will save a great deal of resources for the hospital and the community. We project that the revenue increase by the end of 3 years will be between 200 and 500, and then 5 to 7.5% of annual revenue increase annually, as long as these programs are in good health and good state. Now, this is just a reminder. Our mission is that we are dedicated to the health and well-being of individuals and communities entrusted in our care. And our vision is that by our actions, we define the standards of excellence for public academic health system. And I wanted to reiterate on this mission and vision, because these are the backbone of the strategic plan. And the true reason for Parkland's existence is the community. And on that note, I just wanted to add that truly the ultimate goal of the strategic plan and this facility's goal is that we better the community, because the community is only as strong as its weakest members, and we strive to create health as a culture, because truly once something becomes a culture, it becomes natural and normal and easier to go along with versus having to find and feeling like you're fighting against something. And that does conclude my presentation. Thank you for your time.